Hi, my name's Jewel. I'm a disabled single mother of four. I'm going to share my story today around how I became an incomplete quadriplegic and subsequently went through pregnancies with a spinal cord tumor and severe nerve damage on my C-spine. So in 2014, I was 6 months pregnant with my first child. I had excruciating nerve pain. At the time, I didn't know what nerve pain was. Uh, it essentially feels like an electrical current. I felt like I was being electrocuted, and this came on suddenly during my pregnancy. Being pregnant, I had heard that women can experience back pain, muscular pain. I didn't know, again, that this was nerve pain, so I just assumed it fell under the back pain umbrella. The pain was just terrible, but I was very young. I was 25 years old at the time, and I just didn't think that there could be any substantial health issue. I gave birth to my son in May of 2014, and my back pain got just worse and worse and worse. I had what felt like an electrical current shooting down my spine, down to my arms, to my hands. I couldn't turn my head. It was too painful. I couldn't get out of bed. It was too painful. I was just in what I would call like living hell. I went to the doctors. I begged them for x-rays. They refused to give me an x-ray. They didn't think that there was anything wrong, and that I was just experiencing post-pregnancy back pain. And I'm very small. My son was a bigger baby, and they assumed that there was a correlation between him growing and my back pain. When my son was 11 months old, my back pain was too much to handle. It was unbearable. I couldn't foresee myself living like this at all. Like, it just was not sustainable. And I went to emergency, and no one wanted to give me an x-ray. They thought that I should just be taking an Advil, and that, that this would be fine and treatable with over-the-counter painkillers. I said to them that I wasn't going to leave until I had tests done. So I went in, I did x-ray testing, and I waited for the results. And a doctor came to me and he asked, well, how long have you been having back pain? You said like it's been 15 months. I was like, yeah, it's been 15 months. He's like, well, you have years of trauma on your spinal cord. So I was then taken to go do a CT scan. I got out of the CT scan. A doctor said to me, like, look, there's a mass on your spine. This is not good. So we're going to get you into an MRI. I went into the MRI, and then immediately afterwards, I'm told that I will have to be shipped to a different hospital that has an orthopedic clinic, because they didn't have the capacity. They didn't have an orthopedic team that would be required to treat what I was dealing with, but I wasn't told any details other than that. I arrived at the hospital at Toronto Western, and there was an entire orthopedic team waiting for me. I sat up to introduce myself, and they all literally jumped back. I didn't understand why. I, I just literally sat up in a bed, and one of the team members was like, "Oh my God, you're mobile." I was like, "Well, yeah." He's like, "Well, we saw your scan, and you have such severe nerve damage that we assumed that you're a quadriplegic." I was like, "Well, no, I have full mobility." So I got informed in that moment that I had a bone tumor that had wrapped around my spinal cord that had destroyed 14 inches of it. So it wrapped around, grew inwards, destroyed the vertebrae, and that they would need to perform several reconstructive surgeries on me. It took about a month for them to plan my first surgery. It was actually not in their favor that I was mobile, because they had to figure out how they were going to do a surgery and preserve my mobility. There's so much manipulation of nerves. Essentially, they had to do surgery through the front, where they removed the tumor from the front, surgery from the back, where they do the same thing from the back. They would put in the metal rods, donor bones, and they would cut one of my ribs and put it into my spine to create this like impenetrable structure, essentially. So I went in and had my first surgery, and I woke up and my hands were both 100% paralyzed. That was really, really hard. Shortly thereafter, I went to a spinal cord injury rehab facility. I was the only walking patient there at the time, and this gave me a tremendous amount of gratitude and insight into spinal cord injuries and all the issues that go hand in hand with them. I had no idea about bladder and bowel issues until I went to the spinal cord injury rehab. I don't have bladder or bowel issues, but I had no idea that that was something that was dealt with within the spinal cord injury. I then decided that I wanted to have more children, and we started to try for baby number 2, and this would have been in 2016. I was pretty much fully paralyzed in both hands, but I decided that I would figure it out. We were trying for baby number 2, and it just wasn't happening. I found out during this time that I had a new tumor on my spine, and they wouldn't be able to reach this tumor because of the impenetrable structure that was created. So I was put on this very experimental, newly FDA approved chemotherapy drug that essentially would prevent bone development, and I went on it, and it seemed to keep things under control. During this time, I had planned with my oncologist a roadmap essentially to have another child. I was on this chemotherapy drug for 9 months. I stopped it. We were trying for baby number 2, and essentially the plan was for me to get pregnant, have a baby, and go back on this medication. We were trying and trying for baby number 2. Nothing was happening. We did 2 cycles of IVF, and nothing happened with those. During IVF, you inject yourself with a lot of hormones to essentially kickstart ovulation, etc. I had no idea that I would have any reaction from the hormones being put into my body from these treatments. shortly thereafter, so these 2 IVF treatments failed, and I was devastated. I was also losing my balance. So until this time, I didn't have any gait issues. I was walking and I was falling everywhere. I did an MRI and I was told that I had a new tumor within my spinal cord. This time it was intradural, which is essentially within the spinal cord canal where the nerves are. I went to my surgeon and he's like, Jewel, I can't even do surgery on you because this is intradural. Your other tumor was outside of the dura. So he referred me to his colleague. His colleague sat me down. He's like, I'm not sure if anyone's told you this, but 100% we can confirm that pregnancy hormones caused your original tumor and it caused this tumor. You can't have any more babies. He said that I would most likely be going into a coma and that 100% I would become an incomplete quadriplegic. But he said that most likely I'll go into a coma and die from this tumor. I was then put on 24 times the chemotherapy dose of this drug that I had been treated with my previous tumor from 2016. And they said, like, let's try this out because this is the only non-surgical intervention for you to get treatment, and hopefully we can keep this tumor under control. And it was 5 days later, after taking multiple doses of this chemotherapy drug that had actually only been tested on mice previously during pregnancy, and I found out I was pregnant. So that's sort of the introduction into my world of incomplete quadriplegia and disabilities. I will definitely share my story of going through 3 subsequent pregnancies on chemotherapy during a health crisis, but this is my first video and just very high level as to how I became paralyzed in my hands and how I developed a spinal cord injury in my mid-20s. I will upload more stories and share going through these pregnancies in subsequent videos, but just wanted to introduce myself. Okay, thank you.